If you are joining my life, you're welcome. So, in today's life, I'm talking about hepatitis B. I know some of you might have heard of hepatitis B. Is hepatitis B curable? Some persons confuse this hepatitis B. They think that it's curable, while some persons think that it's not curable. So, is it curable? Can this virus be cured? You understand? So when you go on social media, you see some herbal personnel, people that deals with herbs, they will tell you that come that we can cure you of hepatitis B using herbs. That they can cure you of hepatitis B using herbs. Is it actually true? So to understand this, can hepatitis B be cured? Well, the answer is it depends. It depends. People need to understand that hepatitis B is an infection of the liver. It's a virus that attacks the liver, unlike HIV. HIV attacks our immune system and like attacks the immune system, and once the immune system is attacked, other parts of the body starts shutting down. For hepatitis B, it attacks the liver. And you know the function of the liver. The liver helps to detoxify our body, to remove waste, you understand, toxins from our body. The drugs you take is the liver that helps to remove all those toxins, both the food you eat. So when the liver is attacked, it's a serious issue. Now for hepatitis B, people need to understand that we have two forms of hepatitis B. We have the acute, we have the chronic hepatitis B. The acute form of hepatitis B and the chronic form of hepatitis B. Now, you have to understand these two when it comes to cure for hepatitis B. Now, for the acute, anything called acute in medical terms is something that happens short term, like say something that happens within days, weeks, or maybe few months. You understand? It's not something that takes long. Now we have acute infection, just short-term infection. We have acute pain, just short-time pain. We have something like acute kidney disease, just short-time kidney disease. Then we have chronic. So I just want you to understand the word acute. Then when you come to chronic, chronic is something that is long time, something that can take months to years. You understand? When you talk about chronic liver disease, you are talking about persistent liver disease, recurring liver infection, recurring liver disease. So it's something that takes months, years, unlike acute, something that just within days, weeks, or even months. Now for acute hepatitis B, acute hepatitis B occurs or happens when the virus stays in your body within 6 months after maybe the person is infected with it, the first 6 months after being infected with it. So within this first 6 months being infected with it. Hi, good afternoon. It's my first time joining your life. Thank you so much. You're welcome. Good luck. I can see you. I hope you're enjoying my life. So you can drop any question you don't understand about hepatitis B. I can see you. You're welcome. You can drop any question you don't understand about hepatitis B. I can explain it to you. Now, for the acute, acute form of hepatitis B, the acute form of hepatitis B happens within the first 6 months after being exposed to the virus, after contacting this virus. Like I told you, acute form of hepatitis, anything acute is just like short term. It doesn't stay long like chronic. So now within that first 6 months, our immune system, if you have a strong immunity, that is reason why as a human being you should fight to have a strong immune system. If your immune system is compromised, what's wait a minute, I remember this face. I don't know, maybe you tell me. So that's why as a human being, like, fight to have a strong immunity. If your immune system is compromised, it exposes you to so many kinds of infection. Now within that first 6 months after you may be contacting this virus, thank you for joining my life. I'm so happy. Thank you for joining my life. I have amazing people here with me. Oh. So as I was saying about the acute form of hepatitis B, within the first 6 months of exposure to this virus, your immune system has the ability, your immune system has the capability to fight off this infection completely. Some persons don't even know that they have it. Some persons might even come in contact with this virus. Do you have any brother named Chibike? Chibike? No, 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 no. I don't have any direct brother named Chibike. But maybe extended cousins and Jarabot. But I don't have any brother named Chibike. Where are you from? Where are you from? Where is your hometown? Drop your hometown. Let me know. Maybe from there I can trace. So for the acute hepatitis B, like I said, your immune system has the ability to cleanse it out within the first 6 months after exposure. Some persons get infected with this virus without even knowing, and their immune system silently clears it out without any medication, clears it out. But what happens if your immune system is not able to clear it out? What happens if this virus stays in your body system for more than River States? Okay, you are getting close. You are getting close. You are getting close. You are getting close. Which home term is that? So, if the immune system is not able to clear this virus out within the first 6 months, it progresses to chronic hepatitis B, and that is where the issue starts. You understand? In fact, most hepatitis that are diagnosed are chronic hepatitis B. You understand? You can drop any question you want me to answer in the comment section. You can drop any question you want me to answer in the comment section. So, the first, if the immune system is unable to clear this virus out within the first 6 months after exposure, it progresses to chronic hepatitis B. You understand? It progresses to chronic hepatitis B, and once it gets to chronic hepatitis B, there is no cure for it. There is no known cure yet for it. Once hepatitis B progresses from acute, that's within the first 6 months of exposure, to chronic, there's no cure for it. You understand? So that is why it's good to have a strong immune system. That is why it's good to have a strong immunity that helps to fight out this infection. I'm from River State. That's nice one. Thank you. Okay, Ikwere Isokbo community. Ah, you're welcome. That's also my community. But that the name you call is not my brother's name. I don't know. Maybe someone you're confusing. I don't know, Sha, but it's not my brother's name. But that community, of course, it's my community also. So that is why I said it's good to have a strong immunity when it comes to fighting against infections. So when the immune system is unable to fight up this hepatitis B within the first 6 months of exposure, and it progresses to chronic hepatitis B, there is no cure yet for it. There is no known cure yet. I don't know if maybe as this goes by, they might find cure for it, but right now, there is no cure for it. But it is manageable, it can be controlled, it can be treated. It's not a death sentence. This is what people don't understand. It's not a death. Is you, I know. Okay. Okay, what is my name? Okay, I think you get my name through this video. Okay, where if you know me, like where did I school? So that is how it is about chronic hepatitis B. Once it progresses from acute to chronic, there is no cure yet for hepatitis B, but it is managed, it can be treated. They will give you medication that will help to suppress this virus, that it won't harm your liver. And the issue here is that some persons, they are not even aware they have this virus. That's where the issue is. They are not aware they have this virus until symptoms start showing. And before symptoms start showing, the liver damage is already there. The liver damage is already there. Hepatitis B can result to scarring of the liver, and too much scarring of the liver over the years can lead to liver cirrhosis. You understand? Can lead to liver cirrhosis. Hepatitis B can lead to liver cancer. In fact, it's one of the few infections that can directly lead to liver cancer. That is how dangerous this virus is. I don't know why there is no much awareness about this particular disease. People fear HIV more than you went to modern secondary school. Yes, you're right. Yes, you're right about that. So, where was I? As I was saying that hepatitis B is one of the infection that directly leads to liver liver cancer. You understand? So that's one of it. I'm coming. Let me drop a message.
You've not gone live since then?
I'm live.
Huh?
I'm live.
Now?
Yes. So I'm so sorry I'm disturbing your teaching. No problem. You can just ask any question about hepatitis B. Now, I was talking about hepatitis B. If in case if you are joining my life just now, my many people are curious to know, is it curable? You understand? When you go online, they will tell you different stories. Some will tell you, come and take this herb. Come and take this herb. I know someone that can cure hepatitis. That's not true. That's not true. You need to understand that hepatitis have two forms: acute hepatitis B and chronic hepatitis B. Now, you have to understand the word acute and chronic when it comes to medical terms. Now, we have acute infection, we have chronic infection, we have acute pain, we have chronic pain, we have acute kidney disease, we have chronic kidney disease. Now, when it comes to the word acute, acute means something that is short term, that lasts maybe few days to weeks or maybe few months. You understand? It's not something that is like long term, something that happens sudden. You understand? It can be a sudden infection, sudden, just not that long. Then when it comes to chronic, chronic is something that is persistent, that keeps you occurring, that that can take months to years. So if you can differentiate between this acute and chronic, then you can understand my explanation on acute hepatitis B and chronic hepatitis B. Now, acute hepatitis B happens within the first 6 months after exposure, after maybe you are exposed to the virus. It happens within the first 6 months after exposure. And one thing you have to understand is that our immune system is built in a way that it has the ability, the capability to fight off this infection completely on its own without medication, without taking any drugs. You understand? When it is unable to fight off this infection, it is when it progresses to chronic hepatitis B. In fact, in some cases, some persons might have been exposed to this virus and they are not even aware of it. And the immune system fights it off for them silently. You understand? Silently, without any symptoms, silently fight it off, cure them completely without them knowing. Then, in a case where the immune system is unable to clear it out and it progresses to chronic. Remember, acute only happens within the first 6 months. After 6 months, it progresses to chronic hepatitis B. Now, in chronic hepatitis B, there is no cure for hepatitis because the immune system is unable to clear it out completely. It's unable, it's not able to, if it's not able to clear it out when it's acute, it cannot clear it out when it's chronic again. So in such kind of situation, there is no cure for it. But just that it can be managed with medication. There are medication antiretroviral drugs that they can give you to help to suppress this virus. When the virus is suppressed, your liver is protected. Some persons don't even know how how serious the issue is. They think that HIV is the only thing that they should be scared of. Once they go to test, or maybe they should protect themselves of. No, hepatitis B is more deadly than HIV, in the sense that it can be in your body for years without showing symptoms, without even you knowing that you have this virus. Before you could even start having symptoms, your liver has already started damaging, is already badly damaged. You understand? Before it starts showing symptoms, in some cases, your liver is badly damaged. That's why you see some person with liver issue, hepatitis issue, you see their eyes being yellow. I don't know if you've seen someone like that, with yellow eyes, as if, sometimes you see their leg swollen, sometimes you see their stomach swollen, or their body swollen. This is because the body cannot remove toxin again. Remember, the liver is a filter. It filters out toxin from our body. It works a lot of things, supports our immune system, energy, detox our body from a lot of things we eat. The food we eat contains a lot of bacteria. Imagine the food where you go buy things, fly, perches, cockroach, and the rest. So when you eat all those stuff in your body, the liver plays a role in. Yes, I've seen you one like that. Okay, the liver plays a role in clearing out all these toxins out of our body. So when what happens when the liver is damaged? These toxins remains in our body and start causing harm to ourselves. That is why when you see someone that has hepatitis or maybe liver issue, they are very weak. They are very tired. They can't even walk. Particularly the one that discovered this issue late. The ones that discovered this issue late, you see their stomach as if it's a little big. Their leg sometimes is swollen because toxin is not going off. The body is not filtering all this toxin out. So it's inside your body causing more harm. And one thing people need to understand is that hepatitis B is one of the infection that can directly cause liver cancer. I know what that means. When someone have liver cancer, it's just like a death sentence if not treated on time, or immediately. Because one thing about having liver issue is that it spreads. It can affect the kidney because the liver and kidney works hand in hand to filter things from the body. You understand? The kidney helps to filter urine out of the body, fluids, and the rest. So they work hand in hand. When the liver starts failing, the kidney start also to fail. And one thing about this hepatitis B is that it can stay in your body for years without you knowing. Someone can have hepatitis B for years, 1 year, 2 years, without any signs. Before any signs start showing, the liver is already badly damaged. So that is why everyone should be careful. Not just to be careful, also to take your immune system seriously. Some persons don't know that having a strong immunity can prevent you from a lot of illnesses. Like I told you, in acute hepatitis, the immune system is able to clear this virus out on its own. That is the way God designed it. That is the way it is. It's able to clear itself on its own in acute hepatitis. So this is the reason why it's good to have strong immunity. Now, if you have any question, you can just drop it in the comment section for me. If you have any question, you can drop it in the comment section for me. Some persons don't really know that there's vaccine for this hepatitis B. And it's very kind of, how will I put it? It's very disheartening that some persons are still dying of this illness when sorry when there is vaccine to prevent this, you understand? When there is vaccine to prevent this, and some persons are dying of these these illnesses, there is vaccine for it. In fact, currently now, after you gave birth, within the first 24 hours after giving birth, there are vaccines that they use to inject to the newborn baby to prevent this virus, you know, this viral infection from occurring in the near future. So they vaccinate them immediately they are born within the first 24 hours after giving birth, then subsequent time in immunization. Then for adult, they have their doses. They have those for infants, they have those for children. Then for adults, you take the first dose because it's 3 doses you take. You take the first dose, then you come back again after 1 month later, you take the second dose. Then some persons come back again maybe after another month, but the ideal standard is that you come back again, like say after 4 months, after 4 months to take the third dose. In that way, that you have vaccinated yourself against this infection before you get it. It might take 10 years again, and by that time you can still come back to take another vaccine. So I don't see the reason why people are ignorant of this. Funny enough, these vaccines are free when you go to health centers. Any health centers around your area, or any hospital around your area, ask them if they have hepatitis B vaccine. You understand? Ask them if they have hepatitis B vaccine. Like mine, I think when I was in school, then there was a health center close to my school, so I just went to meet the nurse there. I asked, "Do you people have hepatitis B vaccine?" Say yes, they have, but they normally come every Wednesday to vaccinate people. So I say, how much? It's just small amount. It's not something that is even expensive, either 3,000 or so. But I know very well that it's free. But 3,000 is not worth risking your life. You understand? It's not worth going through a lot of liver issues, going through liver cancer. It's not worth it. So what is disturbing the public is lack of awareness, lack of seriousness, lack of urgency that this particular disease is very, very urgent, is very, very serious, is very, very life threatening. So that is why some persons take it as if it's nothing. Go to hospitals, you see people buying drugs, people that are already diagnosed of this infection, depending on drugs, spending money. Some persons are not that, and they are not even consistent in taking their medication, so it affects the way they look, it affects their daily activities. You don't have to allow yourself to get to such kind of condition when you can just take the vaccine and prevent all this stuff. Understand? Just take the vaccine. If you're in Nigeria, the vaccine is free, but I don't know other countries. But if you're in Nigeria, just go to any health center you see, ask them if they have hepatitis B vaccine. If you have any question about hepatitis B, just drop it in the comment section. I promise to answer. So my question was, is hepatitis B curable? Can it be cured? Because some persons are worried. They are confused. They will hear another thing today, they will hear another song, will say this, that. Actually, we have acute hepatitis B, we have chronic hepatitis B. So you just have to understand these two. Now, for you to understand these two, you have to understand what acute and what chronic is. We have acute infection, acute pain, chronic infection, chronic pain, acute kidney disease, chronic kidney disease. So you have to understand that anytime you mention the word acute, something that is sudden, something that happens sudden, can take days, weeks, or few months. You understand? It just has short time. Then when it comes to chronic is something that is persistent, something that keeps reoccurring. You understand? Something that is persistent, something that keeps reoccurring, can take months to years. So for the acute hepatitis B, Acute hepatitis B occurs within the first 6 months after exposure, after the person might have gotten this virus within the first 6 months of exposure. We call it acute hepatitis B. Then, in such case of acute hepatitis B, our immune system, the immune system is designed on its own to fight off this infection, like fight it off completely. You understand? It has the ability to fight it off without any medication. Some persons don't even know that they have it, and this our immune system fights it off completely. Then what happens if maybe the immune system is unable to fight off this infection, this hepatitis B? It progresses to chronic hepatitis B. It progresses to chronic hepatitis B. Okay, someone is asking, is hepatitis B sexually transmitted only? No, no. Hepatitis B is not sexually transmitted only. You can get it through sex. You understand? You can get it through certain body fluid. So it's not only sex you get hepatitis B. Now, in a case where you have a sore, a carrier has a sore in the mouth. Now, if you kiss someone, maybe you have a deep kiss with someone and that person also have a sore, a wound in the mouth, you can transfer that virus, you understand, through that kiss, because the saliva is mixed with blood and there is a cut and there is an open wound. You understand? You can get it through sharp needle. You can get it through sharp object. That's why I pity all these people that normally goes to salon. Like you go to salon and you see this, you take any sharp object there, the razor, you use it to carve your eyebrows. Why don't you ask the lady to get you new one? You take instruments there that you don't know if they is sanitized. So you can get all this infection through such kind of means. So it's not only sexually transmitted. If you have other questions, you can ask. So you can get it through blood transfusion. Hepatitis B can be spread through blood transfusion. It can be spread through needle, sharp object. It can be spread from mother to child during birth. You understand? It can be spread also through blood contact, through saliva. It's not spread, like, don't get me wrong, hepatitis B is not spread through casual kiss or casual saliva contact. It's only spread when that saliva is mixed with blood, and that blood of an if that means that saliva that is mixed with blood of an infected carrier comes in contact with someone else own, and maybe that person has a wound or a sore in the mouth, and that saliva comes in contact with it, you can easily get it that way. You understand? You can easily get it from such kind of way also. So it's not only sexually transmitted. In as much as you protect yourself, maybe you have one partner, you're not promiscuous, you don't sleep around, you need to also protect your health. You go to the barbing salon, you use public clipper, you are risking your life. Oh, you are risking your life. Those of you that goes to public salon, I don't know how much is clipper that someone cannot buy and keep. Like the whole, like your personal clipper, you buy it, you can spend money on a lot of things. You can spend money on shoes, spend money on health, but you cannot buy clipper and keep. You go on public space where thousands, millions of people comes and they use the same clipper and be no, now you're risking your life and it's not good. Now buy a particular type of clipper. Anytime you want to go to the salon, use it and go to the salon. Let them back cut your hair. Don't use public salon. You're exposing yourself because you don't know how well they sterilize their blade. You don't know how well they sterilize it. When you talk now, they'll say, of course, they use lighter to burn it. You don't know if it is well done. Like, so the best way to avoid that, use your own clipper. If you are going to the salon, don't allow them to use their public stuff on you, those sharp objects. Whether you are doing your nails, don't, just buy your own and take it there. That way you are preventing yourself from getting all this kind of infection. So sex is not the only way that you can contact this type of disease. So in as much as you are not promiscuous, in as much as you don't sleep around, you need to also protect yourself. You need to also protect yourself from getting it in other means. So what are the possible effects hepatitis B has on infected, okay, pregnant woman? An infected pregnant woman, okay, I think they have the drugs for them. If you are pregnant and you have hepatitis B, you just need to go to the hospital. They'll put you on some drugs so that it will also help for you not to infect the baby, because as a mother you can infect your baby. In fact, hepatitis B can be spread from mother to child during childbirth. You understand? That is why you should go for routine checkup. Should go for routine checkup. Let the doctor check you on time. As a pregnant woman, don't just run all these tests once. You run HIV test once and you leave it. You run hepatitis test once and you just, at least every 3 months, go for routine checkup. They will give you drugs. They'll give you medication that will help to protect the child in your womb and also to protect you also. So it's overwhelming. So when it progresses to chronic hepatitis B, there is no known cure for it. So it can only be managed through medication. There are drugs that they will give you that you will be taking, just like HIV. You'll be taking those drugs, just like hypertension, just like diabetes. No hypertension, diabetes, there's no cure. You just have to manage those, control it, manage it. So that is how they would do, give you drugs to manage it. So it's not, someone that has hepatitis B can live their normal life. I can tell you that for sure. It doesn't affect them, doesn't deprive them from living their normal life. The ones that are consistent with their drugs, that takes their appointment seriously. Does PrEP advisable if one is exposed to an infected person? Yes, it is. It is. But how will you know? That's the issue. How will you know that you have it? How will you know that that person have it? You can take the PrEP also, because HIV, PrEP does not only prevent HIV, it prevents other type of infection also. So you can take PrEP also to help. So once this virus progresses from acute to chronic, there is no cure for it. But it can be managed through drugs, it can be managed through medication. So if you have more questions, you can drop it in the comment section. So does PrEP advisable if one is exposed to an infected person? Yes, it is. You can take PrEP. In fact, if you are promiscuous, you know that you don't have one partner or you're not sure of your partner, PrEP is something that you should have. If you are not sure of your partner, one, you don't know your partner status, and it's not one partner you have, PrEP is something you should have at home. Funny enough, it's not expensive. I don't know about now. I don't know how much it is now because of the Trump issue about all this medication. I don't know how much it is now, but I think last time I don't know. Let me not call any amounts. I don't really know how much it is now, but I know very well it's not more than, it shouldn't be more than 50,000, but I don't know. I don't really know the actual price now. So if maybe you have a sexual contact with someone that you are not too sure of, it's advisable you take PrEP. You understand? You take PrEP. But how will you know? You understand? Sometimes we just do mistake. So the best way is just to be, like, say, just have one partner and be sure of that person. Run routine checkup. Both of you should go for routine checkup. All these things help to, like, say, minimize Not like it will completely prevent, but minimize some kind of infection that one shouldn't have. So for the vaccine, hepatitis have vaccine. So you that is asking about prep, why don't you go for vaccine? It has vaccine. I think vaccine is a more safer option than using prep to protect yourself against hepatitis. You can go for vaccine. When once you take vaccine, you don't have to worry about yourself about having the infection. After getting vaccinated, how long will it take for one to get revaccinated? Okay, that's a nice question. Thank you very much. It can take 10 years, it can take 15 years, it can take as long as 10 years, it can take as long as 15 years for you to get revaccinated again. That's how long it is. You understand? So for me, I think it's worth it. Imagine taking a drug that will prevent you from having this infection that damages the liver. And funny enough, this infection is rampant now. If I'm not mistaken, over 20 million Nigerians are recorded to have hepatitis B. And the infection is on the rise currently now because there's not much education out there. People only know about HIV, but they are not aware how dangerous this virus is and how rapidly it keeps spreading. You understand? So instead of taking prep, there's a better option, which is vaccine. HIV, I don't know if HIV has vaccine, but I've not heard of anything vaccine when it comes to HIV. So you can take vaccine and prevent yourself from having this virus. That's a better option because you don't know. Okay, you don't know. So vaccine is more better. When you go to any health center, ask them if they have hepatitis B vaccine. Any health center, I'm sure they will have. Either they come once in a week because they have a particular day during the week they come. It's not every day they come. Either they come once in a week, and the amount is not outrageous. In some hospitals here in Nigeria, is free. Just that they will ask you to pay a little bit of small change. So you take the first dose because it's 3 doses. You take the first dose, after 1 month again you take another dose, then the next one you take after the third, and the second one you take is after 4 months. You come back and take. That's within 6 months. Within 6 months you take the first, second and third dose, and that vaccine will carry for 10 or even 15 years before you come again to revaccinate yourself again. Then for babies, what they do now in the hospitals for newborn babies, they have vaccine for them. Is hepatitis more deadly than HIV? Yes, it's more deadly than HIV. That's what people don't know. It's more infectious than HIV. It's more deadly than HIV. And I'll explain why it's more deadly than HIV. Hepatitis B is more deadly than HIV in the sense that hepatitis B is one of the few infections that can directly cause liver cancer. And you know what cancer is? Cancer is not something that gives you time. You can have HIV and you can live your years, but once you have cancer, liver cancer, it's not something that gives you time. Let's leave liver cancer aside. Now let's focus on liver failure, liver damage, liver cirrhosis. This is what hepatitis B does to your liver. It causes scarring of the liver tissues, the liver cells. So over the years, that consistent attack on the liver cells results in liver cirrhosis. So if you have heard of the word liver cirrhosis before, it's scarring of the liver tissues. So this can result to liver failure. If maybe you have come across a patient that has liver issue, you will understand what I'm talking about, that hepatitis is more deadly than HIV. Not like HIV is not deadly. If you have come across a patient that has a chronic liver issue, the eyes is yellow, the stomach is as if it's big, cause swollen, the leg is swollen, because the body cannot remove toxin again. Remember, our liver filters out toxin from our body. Imagine if we don't have internal filter in our body. Imagine all the food you have been eating, the food you buy on the market. You don't know the hand that touched the cockroach and the flies, and you just invade everything inside of you. So the liver helps to remove those toxins out of our body. Now, when the liver fails, when there's a liver failure, that toxin becomes imbued. It doesn't go out again. It doesn't go out again. What are the symptoms of hepatitis B? Okay. One of the symptoms of hepatitis B is 1, tiredness, weakness. Understand? You feel sluggish, tired. You understand? So many symptoms, both headache, fatigue, abdominal pain. Sometimes you feel pain at your right side, pains along that area. So sometimes the symptoms is not noticeable. Someone can have this virus for years without any symptoms. Someone can have this hepatitis for years without any symptoms. If you are joining my life, you're welcome. Don't wait to subscribe. Don't just go without subscribing. So tiredness is one of the symptoms. Weakness is one of the symptoms. Fatigue is one of the symptoms. Abdominal pain is one of the symptoms. All these, having yellowish eyes. You understand? When you notice that the color of your eyes start turning yellow, start changing the yellow, that's one of the symptoms. When you notice that your leg is swollen, you can touch, you can press it as if you are pressing fufu. So that's one of the symptoms also of hepatitis B. If you have any question, you can drop it on the comment section. So some of this sickness is something that we can easily avoid. Something that we can easily avoid. I don't see the reason why in this day and age someone is dying of hepatitis B when there is vaccine. Do you know what it means that there's a vaccine for something? HIV, there's no vaccine yet though. But there's a vaccine for hepatitis B, and some persons are sleeping around. I would like to sleeping around about this information. They don't take it seriously. What stops you from going to the hospital or maybe health center? Talk to the health consultant or the health provider there. Do you have hepatitis vaccine? It's not even expensive. So why wait till you get infected? Why wait till you start having liver damage? Why wait till you start going from hospital to hospital? So I need to get this. Is hepatitis B curable? Okay. Hepatitis B, let me explain. It depends. Now we have two forms of hepatitis B. We have acute hepatitis B. We have chronic hepatitis B. Now, acute hepatitis B happens within the first 6 months after exposure. After maybe you have gotten the disease or maybe you have gotten the infection. You understand? Now, for you to understand the word acute and chronic when it comes to medical terms, when something is acute, it means when something is short term, it can last for few days, few weeks, or even few months. Understand? Sudden, short term, Then when something is chronic, is when something is persistent. When something keeps reoccurring, it can last from months to years. Now, for acute hepatitis B occur within the first 6 months after infection, after the person might have gotten the infection. Now, after the person might have gotten the infection, our immune system is designed, the way it's designed, it has the ability to fight off this infection on its own. It has the ability to fight off this infection completely, not remaining anything on its own. But what happens when the immune system is not able to fight it off? It progresses to chronic hepatitis B. So in chronic hepatitis B, there is no cure yet. There is no cure for hepatitis B in chronic hepatitis B. When it progresses from acute and the immune system is unable to clear it out after the first 6 months after exposure and it progresses to chronic, there is no cure for hepatitis B. I don't know if I answered your question. So there's no cure yet for hepatitis B, but there are medications that are there that can be used to manage, to control this infection, this virus. So it's not a death sentence. Don't kill yourself if you test positive for hepatitis B, and so that you don't start dying before time. No, there are drugs that are there that you can use to manage it, and you can live your health, you can live in your normal life, get married, have children, enjoy your life, as long as you are faithful to your medication. You understand? So there are drugs that can help suppress this virus, so that your liver stays protected. Because if your liver is damaged, man, that's a life, let's say that's a death sentence on its own. If a person has chronic hepatitis B, can the person still be able to get married and have kids? Why not? Why not? Do you know how many people that's around your streets, village, church that has hepatitis B, chronic hepatitis B, and they are living their normal life? It doesn't show on the face. Will someone come and tell you that they have it? It doesn't show on the face. Nobody will come and tell you, hey, I have hepatitis B. Oh. It's not written on the face. It's not shown on the face. So they can live their normal life, provided that they are faithful to their medication. That is the condition attached to it. Because there is a virus already there attacking the liver. So you cannot live your normal life without taking those medications that helps to suppress those viruses. So you can live your normal life if you have chronic hepatitis B. It doesn't prevent you from having kids, doesn't prevent you from working, provided that you are faithful to your drugs. Because if when you don't take those medication, those retroviral medication, this virus attacks your liver. And this can result to liver failure, liver cirrhosis, in some cases, liver cancer. So you have to stay faithful to your medication if you have chronic hepatitis B. In that way, you can live your normal life. So it's not a death sentence. It's not a death sentence. Just like people that have hypertension, diabetes. No, diabetes, there's no cure for it. It's something they manage. Understand? Hypertension, diabetes. So you take drugs to manage. You take drugs just to. That means it's advisable to run the test for hepatitis B before getting married. Yes, that's one of the criteria. In fact, if you go to any hospital and you ask and you tell them that they should list the type of tests, compatibility tests, you see that hepatitis B is one of those tests that they have to run on you and your partner. When you mention compatibility tests, hepatitis B is there, HIV is there, blood group is there, genotype is there. These 4 major tests, that's what they normally run. But I don't know if currently now they have added more to it. But these 4 major tests are the tests that they normally recommend for compatibility tests. So hepatitis is one of those tests they run in the hospital. or laboratory when it comes to compatibility of your partner in getting married, because this is something that you can easily transfer to your partner. HIV can transfer HIV to your partner. Hepatitis can transfer hepatitis to your partner. Genotype can cause issue in marriage. You understand? Genotype can cause issue where XS, AS, all those stuff. So anything that can affect you, your partner, also affect your children. So they have to screw them out. You understand? But currently now they have added fertility tests also to the compatibility test in the hospital they run now. So I don't know. So yes, they normally run hepatitis tests to check before getting married. So I'll advise people to take this vaccination seriously. Take vaccination seriously. If you're a mother here and you're not aware that they normally vaccinate newborn babies the, within the first 24 hours after birth, ask your doctor, maybe if you want to give birth, any hospital you are going to give birth, ask them before the due date, do you vaccinate newborn infants of hepatitis B? Do you have the this thing to vaccinate? So even if they don't have, they will direct you to the facility that has. So within the first 24 hours after birth, they normally vaccinate newborn infants. Then subsequent immunization, they also do that. Then for adults, for vaccination is in doses. You understand? We have 3 doses. First month, then you come back again after 1 month, you take the second dose. Then you come back again after 4 months, you take the 4th dose. Now when you take this 4th dose of this vaccine can take you at least 10 to 15 years before you come back again to be revaccinated. So vaccine is a way of your body building immunity against this infection, this virus. So the way vaccine work is that they take a little portion of this virus, suppress it. They take a little portion of this virus, they suppress it, and they put it inside of your body in a way that your immune system can attack it. Just like when you take 1,000 soldiers, like we go to war and there are millions of soldiers, and you take just one soldier and you put in your enemy's camp, you put that one soldier in your enemy's camp, what will happen? That your enemy's camp, just one soldier will overtake and kill it. So that is what how vaccine was. They take a little portion of the virus, then they suppress it, then they put it inside your body. Your immune system builds immunity against this virus, recognizes it, now put a copy. So anytime in subsequent years you are exposed to this virus, the immune system already builds immunity, then they launch an attack on it and destroy it. So this is how vaccine work. Vaccine is not like the way people this thing. It's just like reintroducing a suppressed form of the virus inside of your body. Don't worry, I'll make a video specifically on vaccine. I'll make a video specifically on vaccine. I'll explain how this vaccine thing works. You understand? I'll explain how this. That's why sometimes it also has its own disadvantage also. It also has its own disadvantage also. From your explanation, if I get you correctly, is it weak immune system to lead to chronic hepatitis B? Yes, if your immune system is weak, and not just weak, but is unable to clear out this virus within the first 6 months after exposure, and it progresses to chronic hepatitis B, and it progresses to chronic hepatitis B, there is no cure for it. So some persons might have come across this virus at some point in their life, and their immune system completely clears it out quietly, even without them being aware. You understand? Even without them being aware of it. The immune system quietly clears it out completely on its own without any medication. So that is how powerful our immune system is. That is how powerful God has designed our soldiers to fight against infection. Just imagine if the immune system is not there. Just imagine if this immune system is not there to protect us. People will be dying like flies because, outside has a lot of germs. So in acute hepatitis, if the immune system is not able to clear it out within the first 6 months after exposure and it progresses to chronic hepatitis, there is no cure for it. So the best way to prevent all this stuff is to get vaccinated. Get yourself vaccinated. In fact, as a health personnel, is mandatory that you take hepatitis B vaccine because you are coming in contact with patients that most of them have some of them not sorry some of them have several kinds of diseases. So to protect your health, you have to get the vaccine. So you can prevent all this by getting the vaccine. Get vaccinated. And if you're a mom here, if you're a mom, or maybe you know anybody that is a mom that is about to give birth, I just want you to know that there's vaccination for infants, and they normally give them this hepatitis B vaccination within the first 24 hours after birth. They have also for children, just in case after 24 hours is unable. You can still vaccinate other days, you understand? But first 24 hours after exposure, after birth. So that is it. It's already 1 hour here, so I will soon be ending my life. If you're here and you have any question you want to ask me about hepatitis B, just drop your question in the comment below. So my question is it curable? Is it curable? Like, you read so many things online, don't get confused. Don't confuse yourself. There's no cure yet for hepatitis B. When it progresses to chronic, you understand, there's no cure yet for it. Unless it's acute, then our immune system is able to clear it out on its own without any form of medication. So the best way is to get vaccinated. Thank you, my audience. I'll be ending this live now. I really appreciate all of you that are here. And if you're coming across this channel, do wait to subscribe. Bye.